Hi, I'm Sylvia Azania, and we're going to talk about whether exercise improves semen quality and male fertility. We'll talk about moderate exercise, intense exercise, and also cycling. Plus, we'll answer some of the most common questions users might have about this topic. Physical activity has many well-known benefits, such as reducing the risk of diabetes and cardiovascular disease. However, exercise done moderately for about 30 minutes a day is also beneficial for seminal quality. Practicing moderate exercise, especially aerobic exercise, has been linked to an improvement in sperm count and concentration, but also in parameters like sperm motility and morphology. In fact, this beneficial effect of sports has also been observed in sedentary patients with fertility problems and in patients with obesity. Moderate exercise would increase testosterone levels, which promotes a suitable hormonal environment for spermatogenesis, which is the process of sperm formation. So this, has been proposed as one of the mechanisms by which seminal quality could improve with exercise. However, moderate exercise also promotes the oxidative balance in the semen. This would prevent oxidative stress, which has harmful effects on seminal quality and has been linked to sperm DNA fragmentation. If you want to know more about this condition, I'll leave a link to an article in the tags where you can read much more information. Moderate exercise is healthy and improves seminal parameters compared to men who don't include exercise in their daily activities. But virtue lies in the middle ground, and excessive physical activity typical of professional athletes, competitors, triathletes, and marathon runners does seem to affect seminal quality. This decrease in seminal quality seems to be related to a reduction in testosterone levels and an increase in oxidative stress. Reactive oxygen species would increase too much with intense physical exercise, so they would exceed the body's antioxidant capacity to neutralize them. This imbalance causes oxidative stress and therefore can lead to poorer seminal quality and greater sperm DNA fragmentation. Therefore, prolonged, very intense, or too frequent exercise could affect a man's semen quality. Regarding cycling, there are often doubts about whether this sport can affect a man's sperm quality due to its particular characteristics. The truth is that for spermatogenesis to develop optimally, the testicles must be about 2 degrees Celsius below body temperature. However, sports like cycling or horseback riding could lead to an increase in temperature in the scrotal area, which would harm spermatogenesis. In addition, cycling is usually practiced with very tight clothing, which would favor overheating. On the other hand, the impact with the saddle could also contribute to cyclists having worse sperm quality, especially in terms of sperm motility and morphology. In addition, the pressure exerted by the saddle on the nerves and blood vessels in the testicular area could also lead to erectile dysfunction problems. For all these reasons, so that sperm quality is not affected, it is not usually recommended to practice cycling for more than 5 hours a week. And now we are going to answer some of the most frequent questions that users may have related to this topic. What are the advantages and disadvantages of exercise for male fertility? The main advantages of sport in relation to male fertility are found mainly when it is practiced in a moderate way. In this way, sport can lead to an increase in testosterone, a better oxidative balance in the semen, which would reduce oxidative stress, and an improvement in seminal parameters. On the other hand, sport presents disadvantages for male fertility when it is practiced very intensely, as is the case with elite athletes or competitive athletes. In this case, a decrease in testosterone levels and an increase in oxidative stress could occur, which could cause damage to the genetic material of the sperm and has been linked to poorer sperm quality and an increase in DNA fragmentation. Does intense gym exercise affect male fertility? Practicing sport in the gym could affect male fertility if it is done very intensely for a very long time or very frequently, leading to overtraining, in the same way that would happen with triathletes or competitive athletes. The recommendation is to perform moderate exercise for about 30 minutes daily, take care of other habits such as eating a healthy diet, and avoid alcohol, tobacco, and drugs. Does intense exercise also affect female fertility? Yes, sport practiced very intensely can even lead to a woman stopping having menstrual cycles, that is, to a situation of amenorrhea. In this case, if ovulation doesn't occur, the woman won't be able to get pregnant. Additionally, there are other factors associated with intense sports that can also lead to an impact on female fertility, such as having a low body weight and the stress that comes with competition. We would really love to hear about your experience. Maybe if you've started exercising and have left a sedentary lifestyle behind and have seen an improvement in your sperm quality. So I encourage you to leave it for us in the comments. If you liked the video, give it a like, subscribe so you don't miss any of the next ones. I'm leaving a couple of videos in the cards that I'm sure you'll find super interesting. The first one is about whether it's possible to improve sperm quality, and the other is about which foods can improve semen quality. And I'm also leaving a link in the description to an article where you'll be able to read much more information related to this topic.